Hello everyone, I'm sitting here with Professor Dr. Stuart McGill. He's a world-known back pain specialist with over 300 scientific publications. He's a consultant for corporations, for governments, and for professional athletes all over the world. And he's an author of many great books. His latest one just came out a few months ago, The Back Mechanic. It's available on www.backfitpro.com. And I would recommend this one for everyone who's suffering from back pain. It's easy to understand. It's not only for trainers, it's for the normal population. And I had the pleasure to be at your seminar the last 2 days, and I learned amazing new stuff, which I think is really helping me with my work. And I would like you to share a little bit of that wisdom now with everyone who's watching this video. So, would you agree that back and neck pain problems are rising mainly because of bad posture and bad movement habits in our Western societies?
Well, I can't actually answer that question. This is probably an odd way to start. But certainly, back pain is a very individual item, shall we say, and what causes back pain as a trigger in one person is quite different from another. So regardless of whether it's been increasing or decreasing over the years or not, that I don't know. But that book that you mentioned guides the reader through a self-assessment to establish their pain triggers, and then based on that self-assessment, it then guides the person what not to do to move in a way to avoid their particular pain triggers versus what they should be doing, which is to move again in a way to build the base for a pain-free spine. Oh, the name of the book, by the way, is Back Mechanic. And it's available through backfitpro.com.
Right, backfitpro.com. Right. All right. So, would you then say that the diagnosis like hernias or spinal stenosis, that those are only the symptoms, and we need to really find out what the real causes are, and the causes are more like the movement patterns and the postures that people have? Is that right?
Well, yes, I can certainly make a comment on that. So a person who has been told they have a disc herniation, for example, there are many people who have disc herniations and disc bulges that really don't have much back pain. So it's much more important to assess the person to see what their pain triggers are, and you will find they will be caused by very specific motions, postures, and loads. And once you've identified which ones are the painful ones, you know what to avoid in that patient so they can wind down the pain sensitivity, and then you're building a body that's able to perform or engage in exercise in a way that it builds the foundation for more pain-free movement. So just the right amount of mobility, the right amount of stability, the right amount of endurance and strength, for example. But too much or too little of any one of those will not help them very much. But it is tuning their movement patterns for sure. And we might as well tackle one other myth while we're talking about that, is disc bulges don't just happen. They happen for a reason, and the mechanism of most disc bulges, because there's many sub-types of disc bulges, is repeated bending of the disc with a certain amount of load. Too much load and disc herniations don't occur, and plate fractures occur, and not enough load, it won't cause them either. So there's quite an interesting precise combination of movements and load that will lead to disc bulges. Once the patient is aware of those, they know now how to avoid those pain triggers. It might be sitting for a long period of time at a computer, combined with what they're doing, say, in their daily training at the gym.
Yeah. So it's really specific to the person. So there's no one-size-fits-all like yoga or Pilates approach that you would recommend everyone. So
No, there are some clinicians who will say, if you have back pain, go and do Pilates or go do yoga. This is far too generic. There may be some exercises within the Pilates program that is very suited to that particular patient, and there will be other exercises that will hurt them and tenderize them. So I'm afraid it's a bit more specific than that. But understand the specific pain triggers, and then the person will know what to do and when not to do.
And in your book, you speak about pain management treatments that would be more like treating the symptoms instead of treating like the real causes of back pain. Would that include doing back stretches and doing like foam rolling your back or massages too?
Yes and no is the answer to that question. So let's see now. Foam rolling, for example, is not really well targeted. To foam roll the back, we would never do. To roll and push on each spinous process, the bones in your back, will probably cause more pain sensitivity than it will release. Now, I'm not talking about foam rolling your legs or your shoulders or something like that. That I have no problem with. But foam rolling a back is something that we wouldn't do. Massage, once again, it's very non-specific, but a very good clinician will know where to massage and release and create mobility, and they'll know where that person needs stability, and they'll leave that alone. So a foam roller has no brains, but a good clinician will know just where to work that soft tissue and leave the rest of it alone. Whereas a general massage, it might help some back pained people, and it will actually make some back pained people worse. The trick is to know your pain triggers and then match the treatment very precisely.
Yeah. That was the same for me. When I had a two herniated disc and I had back pain, I was always stretching my lower back, but it became too mobile. But the lower back is actually an area where you need stability most of the time, and it's lacking stability, right?
Well, by its very nature, I'm afraid it is, because no engineer would build a flexible rod and then ask it to bear compression. But that's your spine. Your spine is this flexible rod, but if you start squeezing down on it, it will bend and buckle. You need the muscles to form a guy wire system and then tune that guy wire system to allow it to bear load. So it's this wonderful blend of knowing when it should be mobile and when it should be very stabilized to allow it to bear the loads to walk up and down stairs, get on and off the toilet. If you're a patient, all the way through to being a sportsman and you're playing on the soccer pitch and you need that certain amount of stiffness or to lift a weight or to lift your baby out of the crib. Yeah. It's this magical blend of knowing when to be stable and when to be mobile.
So the final question, what are 3 things that you would want every back patient to know? Like, can you like say what like are the most important things that, or maybe like 3 myths that people have that they believe are good for the backs?
Okay, you keep changing the question on me. But if there are 3 things, first of all, know your pain triggers.
Yeah.
And then you will know what to do and not to do. So there's 3 things. But if you want 3 myths, one might be the pain is all in your head. Some patients are actually told the pain is in their head, and it's usually the clinician's fault. It's the doctor's fault. They've given the patient an inappropriate therapy. The patient didn't get better, or they got worse. It can't be the doctor or the physio or the chiro or whoever it is. It can't be their fault. It must be the patient's fault. The pain is in your head. And this is a terrible thing to tell a patient, that it's in their head. Instead, you liberate the patient by showing them the mechanism of their pain and then showing them, now, if you move this way, you don't have pain. But if you move that way, you will get your pain. So there's quite a powerful myth. Some people think that, sitting is the easy job, and if you've got pain, sit. Well, for some types of back pain, that's true. For others, it isn't.
Yeah, and so maybe the last thing, like a lot of people think they have to like do some and as many as they can strength exercises for their back. Would you say that's true, or is it most of the time probably not?
It's false. It's not true. I don't know of any good study that has shown having a stronger back reduces your risk of having future back pain. In fact, those same studies have also shown the more mobility you have in your back, you're probably increasing your risk of future back troubles. But instead, it's the just right amount of mobility, not more. So having more strength or more mobility is not the secret. It's to understand the pain triggers and then get just the right amount of strength. But things like endurance, the ability to repeatedly do an exertion without breaking form, turns out to be a lot more protective and a lot more important.
Mm-hmm. All right, thank you so much for these insights. I hope they will help a lot of people, and yeah, I'm looking forward to the next seminar.
Okay, well, thank you very much, first of all, and thanks for all that you do with your good work, so thank you.